A bursitis in the shoulder is a very common lesion. The question is, however, which bursitis are we talking about? Mostly we talk about a subdeltoid bursa, but there is a difference between a chronic bursitis and an acute bursitis. The chronic bursitis is far more frequent than the acute one. And the clinical image of both bursae is completely different. A chronic subdeltoid bursitis, what do we find? Well, we're going to find end range pain on passive lateral rotation. You're going to find end range pain on passive elevation and also end range pain on passive medial rotation. Possibly also a painful arc on medial rotation and possibly also a painful arc on elevation. The acute bursitis is completely different. The acute bursitis, there's a lot of pain. The patient has constant pain. Where is the pain? Somewhere in the C5 dermatome. And movements are very limited. For instance, the active elevation is going to be very painful and very limited. It doesn't go further than this. Rotations, passive lateral rotation, very painful, very limited. Medial rotation, very painful, very limited. And with certainty, there is no painful arc. The subdeltoid bursa consists in fact of two parts. We have a subacromial part, which we cannot palpate, and on the other hand there is a subdeltoid part, which you can palpate. In case of a chronic subdeltoid bursitis, there is a problem with one of those two parts. Either the problem is more subacromial or the problem is more subdeltoid. If the problem is subdeltoid and you palpate the area of the bursa, then you're going to find one sensitive spot, let's say a piece of €1 or so, but it's one small sensitive spot which is painful on palpation. Let's imagine palpation in this area is completely negative, then the lesion is not in the subdeltoid part, but the lesion lies more in the subacromial part. When we talk about an acute subdeltoid bursitis, then in fact you have a severe inflammation of the total bursa. Subacromial part, subdeltoid part, everything is inflamed. And then of course the palpation is positive, but you don't find a single positive spot which is painful on palpation, but you find every spot in this area is going to be quite painful on palpation. And this is a major difference with the chronic subdeltoid bursitis. Let's summarize the clinical image of an acute subdeltoid bursitis and a chronic subdeltoid bursitis. Well, let's have a look at the first test, active elevation. In the acute case, this is really very limited and very painful. In a chronic bursitis, it is just slightly painful. The passive elevation, again in the acute version, very painful, very limited, and in the chronic version, you just have end range pain. The same applies for the rotations. In the acute version, rotations are also painful and limited, but they are less limited than the elevation. Elevation is really the most difficult movement. In the chronic version, again, it's only end range pain. What about painful arc? With an acute bursitis, there is never a painful arc. This is an absolute certainty. With a chronic bursitis, there could be a very clear painful arc, but the painful arc is not always a certainty. Talking about the resisted test, the resisted abduction, the resisted lateral rotation, well, in an acute version, this is also going to be painful. Because of those contractions, you get more compression on this inflamed inert structure, so it's logical that those tests are also positive. With the chronic version, it depends a little bit on where exactly is the irritation in the bursa. They could be positive, but they are not going to be very positive, and it's quite possible that they are even negative. And when we talk about palpation, yeah, of course, with an acute bursitis, palpation is positive everywhere in the complete subdeltoid part. When you talk about a chronic bursitis, well, then it depends where the lesion is. If the lesion lies in the subacromial part, palpation is, of course, negative, because you can't palpate it. If the lesion lies in the subdeltoid part, then you're going to find one local little spot, which is tender on palpation. So the difference between the two is very clear. Which one is the most frequent one? The chronic one is absolutely the most frequent one.